So are you really confused by the changing in wording out of the CDC's vaccination schedule compared to the previous vaccine schedule and that followed by the American Academy of Pediatrics? If that is the case, I understand completely. I'm Dr. Tracy Tyson. I'm a board certified general pediatrician, and I've been doing this for over 20 years, and I want to try to help break it down as best I can. I probably will have to break it down into each individual recommendation so that these videos aren't too long and cumbersome, but I'll try to link them together to see if you can watch all of them. The first one is the only thing that was changed in our vaccine schedule in the United States was wording. It changed nothing. The recommendation is that these vaccines are still safe and appropriate. So if there was scientific information that these vaccines were unsafe, you have the most anti-vax and political health and human services and CDC in American history. They would have changed those recommendations, but even they know that they can't, that there's really nothing behind that. So what they did was to try to instill more distrust in the vaccine schedule by changing the wording in the hopes that that would give them what they want, which is don't trust the experts. Don't trust your pediatrician who's providing the medical care. Don't trust the American Academy of Pediatrics. Don't trust the American Medical Association. Don't trust the World Health Organization. And ultimately, you know who that hurts, and that's our kids. So let's talk about why each one of these recommendations was routine and should stay routine and what that means for your kid so you can make the best decision you can. This is not medical advice. Please still talk to your own child's medical provider, but I just want to try to give you the best information that I can to see if maybe it will help. So the first one is the change in recommendation for the hepatitis B vaccination for newborn. So the ones that we give, we call it eyes and thighs in the newborn. We give a hepatitis B vaccination, a vitamin K injection, erythromycin in the eyes, and that's standard for every child in the United States. So let's talk specifically when they changed the wording to routinely or universally recommended the hepatitis B vaccination to only routinely recommended if mom is positive, but otherwise shared decision-making with your child's doctor. So that is actually really dangerous. And the reason why is that takes us right back to where we were. That is exactly where we were in 1999. In 1999, only if a mom was positive was a baby given the hepatitis B vaccination. And in 1999, we still had 11 to 16,000 children every single year who were positive for hepatitis B from birth or the first few weeks of life, born to a mom who tested negative. Of those 11 to 16,000 children, 90% went on to chronic liver disease and cancer. So that is obviously unacceptable when you have a vaccine that prevents 99% of transmission, even to a positive mom. We went down to 0 children who contracted hepatitis B from a mom in the United States. And so because of that, that recommendation has held fast since 1999. Will eventually that recommendation by science need to be changed and go back? Potentially. Once you have several generations of parents who are vaccinated for hepatitis B, and we go so many decades without anyone being positive for hepatitis B, there is the potential that that recommendation could start to change. But we weren't there yet because there were still cases that were coming up after birth that were kind of unexplained and they didn't know where the child was getting it from. They couldn't make that recommendation based on science yet. And that's why even the CDC said with shared decision making, you can still have it because they couldn't say there was any danger in giving the vaccine. This vaccine has been shown to be extremely safe and extremely effective. Does every individual child in the United States necessarily need that vaccine? It's hard to say for sure, right? It's kind of like saying, does every single person that get in a car always need their seatbelt? Because you don't know that, right? You don't know, are you going to get into a car accident? If you do get into a car accident, are you going to get into an accident that's exactly the right way where you would not need your seatbelt on? But the evidence was so overwhelming that the risk of the seatbelt was so much lower than the risk of death or dismemberment when you got into a car accident that became a universal recommendation for everyone. I don't know if you guys are old enough to remember, but there was a lot of hullabaloo when that recommendation was made because there was like a 1 in a million chance of injury from the seatbelt itself. And so anytime there's a universal recommendation made, there is a really small chance that there is a negative consequence to that. But vaccinations are about the health of an entire population, and that is why routine is so important. So I want you to just understand where each one of these recommendations come from, because we in public health and in medicine can't look at you individually and tell you exactly what your risk factors are. We can look at numbers of when it was missed, and if it was missed, what is the chance of your child having chronic liver failure and cancer? And I know as a parent, presented with all of that information, I gave the vaccine to both of my children at birth, even though I tested negative and I was vaccinated for hepatitis B, and I would do it again. I know that this ruffles anti-vax feathers, but I have never seen a side effect to the hepatitis B vaccination. That doesn't mean I'm not listening. That doesn't mean I'm not reporting something. There's not some ulterior motive here, guys. I have never seen a side effect to the hepatitis B vaccination. The reports that we're seeing coming out of every country in the world that gives the hepatitis B vaccination, whether it's universally recommended or only to certain populations, we've been giving this since 1999, and we are not seeing a significant side effects from this vaccination. So I just wanted to kind of give you some of that in real world language. I'll also go over the other changes as well. And like I said, I'll try to link them, and so you can listen to them all together. If you have any questions, please ask. I'm happy to try to do some follow-ups to this if there's any specific questions. Take care.